Welcome back to Good Morning Connecticut. Plenty to get to this half hour, but first we want to take a look at our health headlines. Today we have tips for preventing ankle sprains, what to know about bunion surgery, and how hammer toes can be corrected to improve your mobility. Joining us to break it all down, Dr. Sean Baden, Yale Medicine orthopedic surgeon specializing in foot and ankle conditions and assistant professor at Yale School of Medicine. Doctor, thank you so much for taking the time to talk with us.
Thank you. It's nice to be here.
Well, so let's start with what are some tips for stabilizing your ankles, especially as we head into fall and winter, to prevent any type of sprain?
Yeah, so ankle sprains are really common. That's usually where you twist your foot under yourself, and it's one of the most common injuries year to year that anybody has, period. And prevention is really important. One of the first things I always look at when patients come to see me with a problem or they want to talk about preventing problems is footwear. Your shoes really do matter. Quality footwear, well-built footwear is really important. So depending on what you like to do, if you're a hiker and you want to get out, wearing the right type of shoes for your activity is really important. So good supportive shoes, hiking shoes, if that's what you're doing, or tennis shoes, or pickleball is really popular these days. Wear the right shoe for your activity, make sure it fits properly, and put them on properly, lace them up real good. That's always an issue with the kids and stuff where ankle sprains are really common. Additionally, if you're someone who's had ankle sprains in the past, I think it's really important to consider using an ankle brace. Some people think having a brace on your ankle can make you weaker. It's not really true. Wearing a brace on your ankle will protect you from hurting your ankle. And then one of the best things you can do is stay in shape, take care of yourself, and really work on your balance. Balance is critical. If you train with a trainer or even a physical therapist, if you have problems with your ankle in the past, can really go a long way to improving your mobility and balance such that ankle sprains are less common.
Another thing that people often talk about, or even say it bothers them, we're talking about bunions. So how can someone maybe looking for a solution maybe end up towards surgery?
Yeah, so bunions are also very common. And the solution to a bunion really depends on what the problem is, because some people, for a bunion, which is a bump on the inside of the foot near your base of your big toe, is more of just a cosmetic concern. And in those cases, I tell patients that it's best lived with. It's a bigger problem than a bump or a mole in other parts of your body. So it's not something I'd ever recommend getting treatment for simply cosmetic concerns. But bunions can be very painful, and they can also be very limiting, meaning they don't necessarily hurt a lot, but they can really limit a person's ability to wear normal shoes. This is a time of year where it's starting to get cold enough that a lot of people will have a bunion and just wear sandals and flip-flops because it doesn't hurt, it doesn't squeeze on the bunion, and it starts to get so cold they can't wear those sandals anymore, and they come into the office looking for solutions. So surgery is reserved for patients who have continued pain or significant limitations in their footwear. And bunion surgery is not something to be taken lightly. It's really important that the only way to really fix a bunion is with surgery, but it's a complicated surgery that I highly recommend getting opinion from at least one, if not multiple, well-trained doctors. And the advancements really have been substantial with bunion surgery in terms of making the recovery much easier and the risk of complication much smaller and the incision smaller. One of the things that I do for bunions is I perform a minimally invasive bunion surgery, which means no actual cuts and openings other than a few little tiny poke
Oh,
holes.
wow.
And patients are very happy with that. They generally are thrilled. It's still a serious surgery. I don't ever tell somebody to take it lightly, but it's a very major progression that's taken hold in the last 5 years or so, and I'm thrilled with the outcomes for my patients.
Wow, a lot of good information. I know a lot of people do struggle with so much of what you talked about, ankle sprains and bunions. So great information there. Dr. Peden, we really appreciate you taking the time to talk with us this Friday morning.